consider that everybody must have been born somehow through whatever way of delivery. It all depends on where you are and what the doctors think about the labor process. It may be through caesarean section, normal delivery, or even forceps delivery, which is instrumental. But either way, once there's a pregnancy, there will be a delivery. Today we're going to discuss about caesarean section. And there are different types of caesarean section, but today we will talk about planned caesarean section. Today I will not go through the process itself in theatre, what happens in theatre, but I'll be brief about it because today I'm just discussing caesarean section. In another video, I'm going to discuss the process of caesarean section in itself. So once the patient is prepared for caesarean section, for the caesarean section to proceed, before you are taken into theatre, there are a few things that must be done right as a precaution for the safety of the mother and the baby. Preoperatively, full blood count, otherwise known as FBC, and group and save must be taken. H2 receptor antagonist should be prescribed, for example ranitidine, and given before surgery. Any antiemetic should be also prescribed, since the pregnant woman is lying flat on the caesarean section. There is a risk of Mendelssohn's syndrome, which means there may be aspiration of gastric contents into the lungs, which may lead to chemical pneumonitis. This happens because the gravid uterus applies pressure on the gastric contents, pushing them upwards. After all this has been done, the woman has had regional anesthesia. She will be positioned on the table on a left lateral tilt with 15 degrees to reduce the risk of supine hypotension, which may be due to aortocaval compression. An indwelling catheter to empty the bladder is inserted to prevent bladder injury during surgery. Proton boots will be applied to the legs and turned on to keep massaging the legs to prevent DVT of the legs throughout the procedure, since the woman's legs will be paralyzed and they'll not be mobile until the surgery is over. When everything is ready and done as planned, the nursing team have prepared all their sterile instruments, and the midwife may need to do a last check on the baby's heart rate. And if the patient was on continuous fetal heart rate monitor, then it will be discontinued. The abdomen will then be prepared using antiseptic solution, and antibiotics may be administered to prevent infection before the skin incision. Patient drips will be applied aseptically, taking care not to contaminate anything. The surgeons will then communicate with the anesthetist, who will give them the okay for skin incision. Then once they're in, uterine incision will be done and the baby will be delivered and handed over to the midwife if in stable condition. Otherwise, the neonatal team may be around in emergency cases. If the baby is okay and stable, the baby will be delivered straight onto the mother's chest for skin to skin, while they wait for 1 minute before clamping the cord. In case the baby needs further monitoring, then the neonatal team may have to transfer the baby to neonatal unit for further management. And when stable, it will be returned to the mother before discharge. The maternal blood loss must be monitored and recorded. The uterus is cleaned and stitched together after delivery of placenta. Oxytocin 5 units is given IV by the anesthetist to help with the contraction. Once everything has been done, the patient is taken to anesthetic room, which is the recovery room. Observations are recorded. Lochia, which is the vaginal bleeding, blood loss, will be monitored, and early warning signs recorded. Then the patient is supposed to be encouraged for early ambulation. Patient is encouraged to move around. Early mobilization is encouraged once the catheter is removed to enhance recovery. But before we talk about these planned caesarean sections, what is caesarean section? It is a surgical delivery of a baby, normally through a cut or an incision made in the parent's abdomen and uterus. The baby therefore is taken out through the belly, not the normal way through the vagina. It's usually done for the safety of the parent, the baby, or both. Caesarean section is commonly performed when a normal birth is not possible or in an emergency situation where the risks of labor and childbirth would be risky due to the length of time it would take to deliver the baby, or if it's a risk to the maternal side, if the mother has conditions that are predisposing normal delivery being difficult, like cardiac. Are you pregnant and having a baby soon? Are you term? Do you have planned caesarean section, or you're having a normal birth? If you're having planned caesarean section, this is for you. Is your relative having a planned caesarean section? This is for you. If you are born through caesarean section, this is for you. Let's talk about caesarean section today. Let's all meet at the comment section, because caesarean section is a procedure just like any other major surgery that needs to be discussed and everybody needs to be aware of. You were either born by caesarean section, or your baby was born through caesarean section, or someone in your family has had caesarean section to have their babies. Let's meet at the comment section below and discuss. Caesarean sections are therefore classified in four categories. Category 1 caesarean section is when there is immediate change to either mom or the baby, or even both, and the baby has to be delivered within 30 minutes from the time. This is a baby who has to be delivered within that shortest time to save the mother or the baby's life. Then there is category 2 caesarean section. This caesarean section is where there is no immediate life threat to both mom and the baby, but could be due to maternal or fetal compromise. The baby should be delivered an hour after the decision time that the woman requires caesarean section. In category 3, the caesarean section, there is no maternal or fetal compromise, but needs early delivery. This baby should be delivered within 24 hours after making the decision to have a caesarean section. Then there is category 4. Category 4 is the elective caesarean section. It is planned in advance. If there are concerns about safety of vaginal delivery after 39 weeks pregnancy, to reduce the respiratory risks in the neonate. Concerns may be due to several other reasons. For example, if a woman has had 2 previous sections or more, whereby if the mother is allowed to labor, there may occur a uterine rupture, which can be fatal if not managed well. Then there is a previous birth canal injuries during a normal childbirth, like a 3rd degree and a 4th degree perineal tear. The perineum is that space between the vagina and the anus. So the doctors will do elective caesarean section so that they prevent the woman having another tear down below, and which may cause a fistula. Other reasons are fetal conditions, where the fetus is compromised and may not survive going through labor. These are usually identified as abnormal fetal Dopplers or growth retardation. So the baby is delivered through caesarean section because they cannot go through the vagina. Another reason where elective caesarean section is preferred is where there is malpresentations. For example, unstable lie. This is where the fetus position keeps changing from one time to the other, from the head presenting or the next minute the baby is lying transverse, the next minute the baby is lying oblique. So it's not possible to deliver a baby who is transverse or oblique. Bridge presentation is where the baby will also be coming with the bottom first. Sometimes if they're presenting really, if they're coming bottom first, then they will do a caesarean section. There is multiple pregnancies, which is twins, where the first baby is also presenting with the feet first or a transverse lie, so you will not be able to deliver the babies. Then there's maternal health. The mother may have some medical conditions that could be fatal if she was left to go through normal labor and deliver. Most of these cases are heart-related, like cardiomyopathy. Another reason for elective caesarean section is when the mother has some infections like vaginal warts or syphilis, which may affect the child if delivered vaginally, hence ophthalmia neonatorum. If a woman has had rectovaginal fistula, this is a fistula connecting, like a hole connecting between the vagina and the rectum, the woman will have a caesarean section. And also in the conditions where the birth canal is occluded by the placenta, like in placenta previa major, where the placenta completely blocks the cervix, making it impossible for the baby to be delivered normally through the vagina. Or where the placenta is in its normal place, but there is no occlusion of the cervix, but the placenta is attached, is adherent to the uterine muscle, which is called placenta accreta. There is no demarcation between the uterine muscle and the placenta. Hence, a caesarean section, because there's no way you're going to deliver the placenta and the woman ends up bleeding. So to avoid hemorrhage, it's better to do a caesarean section and deliver the baby and deal with the consequences of bleeding after that, because the placenta will not separate from the uterus. Diabetes is another reason why the woman will go through caesarean section. A diabetic mother, where the baby will be 4.5 kilos and predisposing the risk to the mom and the baby. Other reasons are fetal conditions, where the fetus is compromised and may not survive going through labor. These are usually identified as abnormal fetal Dopplers or growth retardation. So the baby is delivered through caesarean section because they cannot go through the vagina. History of major shoulder dystocia also makes the doctors decide for caesarean section. There's also primary genital herpes. This is herpes simplex virus, and if diagnosed in third trimester, it means antibodies did not have enough time to cross over to the baby via the placenta to protect the baby, so the baby must go through caesarean section. But there are times when the woman will request, there's maternal request for caesarean section. The mother will request not to go through labor. This may be due to previous traumatic birth experience. The team will discuss this, and if they agree to give the woman a caesarean section, even if she's capable of having a normal delivery, the team will agree and agree to do the caesarean section, but the woman must go through counseling first. So where did the name caesarean section come from? During Caesar's time, caesarean section was only performed if the mother was either dead or was dying. The Roman law under Caesar was that all women who were affected by the childbirth must be cut open. So what are the risks of caesarean section? It also has risks. Caesarean section, just like any other major surgery, can be risky and may also come with its complications. Some of the most common complications will include above average blood loss over 500 mils, blood clots in the legs, which is DVT, which we discussed in the previous video, which I will link below this video. Then there is amniotic fluid embolism, which is also a rare case where you find amniotic fluid leaking into the bloodstream, and this is fatal. Other complications of caesarean section include infection in the lining of the uterus, otherwise known as the womb. The woman will present with abdominal pain, fever, foul-smelling discharge from the uterus. Most women wonder whether vaginal delivery is more painful than a caesarean section. It is believed that a natural birth, which is a birth through the vagina, is more painful than caesarean section, especially if under no pain relief like epidural. The pain occurs mostly at the time of labor till birth, and basically after that people tend to forget, and because of the joy of having the baby with them. However, it is believed that caesarean section after pain is worse because it takes several days or weeks during the healing process, and there is also heightened risks to the mother and the baby. Remember, in caesarean section you've gone through layers, like you've gone through the skin, subcutaneous tissue, the muscle, then rectus muscle, and then into the uterus. If you go through all those layers, then recovery will be long. There's also the risk of venous thromboembolism, which should also be calculated for every woman, and antithromboembolic stockings be worn. Sometimes they give a dose of heparin, a small dose of heparin, to prevent blood clots. So what happens in anesthesia? Most caesarean sections are performed under regional anesthetic, and where this is not possible, like in regions where there is no specialist to perform this, regional anesthetic, general anesthetic is performed. It's most commonly used. The most commonly used are epidural top-up, if the woman was coming from labor ward with an epidural already, or spinal if the woman did not have epidural on labor ward and is just coming for electives, and combined spinal epidural, which is spinal and epidural together given to the woman. And at worst, in situations where they have to save the life of the baby and the mother, they will give general anesthetic if the life of the baby and the mom are compromised for first delivery, even if they already had epidural. General anesthesia may also be required if the regional anesthetic has failed to achieve regional block as expected, or if the block goes too high to the woman up to the almost up to the chest, and the woman is unable to breathe normally. In some cases, it is preferred due to maternal contraindication to regional anesthesia. This today was a video for parents undergoing caesarean section. I did not go deep into the details of anatomy of caesarean section. I will do that in another video. At some point, I will present a detailed one on the step-by-step. I am Evelyn. I do hope this video has been helpful if you have planned caesarean section coming up. If you have had one before, what was your experience? Would you have another one another day? And those who have had normal delivery and caesarean section, which one is better than the other? Which one is more traumatic? Which one took long to recover? If you're new to this channel, I welcome you. Please subscribe, like, and share so that you get more videos from me. For those returning viewers, thank you so much for trusting on us. And thanks for coming again. Let's meet at the comment section down below and learn from each other, whatever experience, whether you were born through caesarean section, have you had caesarean section, has your relative had a caesarean section, what did they go through, what is their experience? Thank you for watching. See you in the next video.